Okay, all right, so this is gonna be the cardiovascular video. We'll skip vitals since you know how to do that. The first part of the general inspection is you're gonna make sure that the patient is relaxed. So you're checking their level of anxiety, you're checking to make sure they're not short of breath. You're gonna sort of check the skin tone and color so you can see that he's pink. Check all the way down to his fingers, it's pink. There's capillary refill, comes back quickly in both sides. You are then also going to look at the precordium. So you're just, again, kind of watching him breathe just to make sure there aren't any abnormal pulsations of the chest. Then the correct position for the supine is with the bed at 30 degrees. So go ahead and lay back for me. So it's less than a 45-degree angle, so a little less. There, now I'll try. Okay. So you are again inspecting in this supine position to make sure that there is no sort of lifting of the chest wall. You may see prominent pulsations of the aorta and of the heart, but you're looking for something that looks abnormal. So again, making sure that the rise and fall of the chest is symmetric. You can also look as we get further into inspection with the light across the chest. Okay, so again, just making sure that there aren't any abnormal pulsations. You can see that there is a pulsation from the chest, and the PMI is going to be in general in this area. Then you go into palpation. So the palpation first of the chest or the precordium is you're going to do the sternal borders, and then you're going to do the base of the heart and the apex of the heart. And this is really just to make sure there's no tenderness, that there isn't anything that feels like Rice Krispies, like there's air stuck in the skin space. Then you're feeling for the heaves, lifts, and thrills. So the heaves and lifts you're doing with this part of your hand, the fingers and the palm, and you're doing the same locations. Then for thrills, you're feeling with sort of the meaty part next to the wrist, and again in those same locations. The heaves and lifts should feel like rhythmic lifting. The thrills should feel like a vibration under the skin. Then you're going to try and find and feel the PMI. So you looked with the light inspection. You see that there is some sort of pulsations there, but you really want to count rib spaces. So 1, 2, 3, 4, 5, and then you're going to get medial or mid-clavicular. So it's either mid-clavicular or just medial to mid-clavicular. Okay, and it's a tapping quality only under one finger. So that's what you should feel, and that's normal. Then you can turn the light off since you don't need to do any more inspection, and you're gonna listen. You listen in 6 spots. We want you to actually state and find the spots, especially in the very beginning. So it's gonna be a combination of lifting the stethoscope, finding the right rib space, and actually saying where you're going. So you're starting on the right sternal border. You're in the second rib space. So listen first with the diaphragm. That's going to be aortic. Then you slide across to the left sternal border, second intercostal space still. That's pulmonic. And then down 1 rib space, pulmonic again. Then you're dropping down to the 4th rib space, tricuspid. Then another rib space, still tricuspid. Then you're going to be over where the PMI was. That's going to be the mitral. So you want to listen through a couple of S1, S2 cycles to make sure that you are listening long enough to hear abnormalities. Then you switch it to the bell. So on my stethoscope, it's all in one. I was pressing firmly, now it's just resting. So you do the same areas. For those of you who pulled off the diaphragm on this other side, you can flip the stethoscope to the other side and listen, and that can be the bell. Okay? Then you're gonna do similar things, but you're gonna have the patient roll up toward that direction. So roll up on your side. You're gonna try and find the PMI again. So if you can't find it in the supine position, you may be able to find it in this position. So you can see it in here. To confirm that you're in the right spot, you can count rib spaces. Yeah, so it's in this about the same location. It may just push down just a little bit with gravity, but in general, it's in the same position. Then as far as auscultation on this, you only listen, I think, over the PMI. Yeah. And you're using the bell. So it's either light or you're switching to this other side. And then you have the patient sit back up. So sit up for me. And then the last position is having the patient leaning forward. So you're gonna do palpation again. So you're doing all of the steps you did before. So the first one's just to make sure there's no tenderness across the chest. The second one with this part is for heaves and lifts, and then thrills is the last part. Then you have the patient take a deep breath in, and then deep breath out and hold it for me. And then out and hold it. And you're going down the left sternal border. And then out and hold it. And then out and hold it. Good. And you're doing that with the diaphragm. Okay, so the last one is down the left sternal border and at the apex with the diaphragm.